So, I'm here today with Dr. Jerry Wyland, who is our speaker and also serves on the Board of Trustees and has just been an involved MSMA member and physician in our Mississippi community for so very long, and we're very grateful for her. She serves as a pediatrician and has for years. So, Dr. Wyland, would you mind sharing with us a little bit about why it's so important to continue to be an advocate year after year for important issues such as immunizations?
Well, since that's one of my passions, I would love to talk about that. I am so proud of Mississippi State Medical Association. MSMA, year after year, keeps fighting to be sure that our immunization laws stay strong. This is not an effort to not keep people from having some choice. This is about the protection of the youngest and the most vulnerable of our patients here in Mississippi. Um, it seems, and it always amazes me, it seems that every year we have to try to keep our laws strengthened because someone tries to weaken them. I mean, what Mississippians should be so proud of is we have the best laws in the country. We have the best protection for our youngest patients, youngest Mississippians in the country. And it's admirable. We're not really at the top of a whole lot of things, but we're at the top of this, and it's a great thing to be. I was thinking back, my son just recently did pediatrics at Vanderbilt in Nashville, and he was talking about a child who had come in and they had fever and they were cranky, and he was worried about bacterial meningitis. I went, huh? Because in Mississippi, I mean, you should think about it, but our immunization rates are so high. We just don't have that. We don't have these enclaves of people who are not immunized because they're given the choice not to immunize. Um, I was thinking just the other day, my last case of H flu meningitis, Haemophilus influenza, it's got nothing to do with the flu virus, it's a bacterial meningitis. Was shortly after I went to Vicksburg to start practice, which was in the mid 1980s. I started in 1983. She's in her 30s now, but she was 11 months old, and we caught her very early, but you do that tap and you see the cloudy fluid come down and you've got a problem. This child required 10 days of IV antibiotics. That's the minimum. That was the minimum. So your child is in the hospital for 10 days. There is an inflammation around the brain. This child was 11 months old when she got sick. She had to relearn to walk, and she was left with hearing problems. But she really was the lucky ones. There were a lot of children who didn't survive, even after they made it to the hospital and they got IV antibiotics. They just did not survive this. And I think what's hard is we are so successful with our immunizations that we forget how horrible it was to have an 11-month-old who no longer can sit up or walk and may or may not live because they did not get an immunization that could have prevented it. So we're sort of a victim of our own success. I am just so proud of State Medical for taking this on every year.